Leaders say our efforts and sacrifice is working, but there's a long way to go.
KCAL 9's Dave Lopez has more on the extended orders and some new guidelines.
At least 5 more weeks of these tight restrictions, not because we are told what we are doing is failing, but because it's working.
We know it's effective, but we still have a ways to go in order to both protect the lives of people who live in our county and to make sure that our healthcare system remains fully able to service all who need their care.
And the long-awaited model explaining how this war against this virus is going was unveiled.
If physical distancing doesn't continue, similarly, we would project that by April 1st, by middle of the summer, virtually all residents in Los Angeles County would have been exposed or infected with COVID-19.
That number exposed to the virus, she said, would have been 96%. But because of physical distancing and the stay-at-home edicts,
we project that we'll be able to reduce the overall infection rate among the community down to 30%. It's a huge decline.
And with an even better effort to self-isolate, by August 1st,
the total number of people infected would be less than 10%.
And the model shows if this is the case, there would be no shortage of hospital beds, no shortage of ICU beds, and no shortage of ventilators. But it's going to take an all-out effort for weeks to come.
I'm as sad as you are to note that this is not the time to lift.
And she emphasized the importance of the mask, wearing them inside buildings and outside when you're around people.
You need to make sure that it's going to cover your nose and your mouth.
Keep your distance at 6 feet and make sure you wash your hands thoroughly before and after using the mask. And keep your mask in a paper bag. If we stay the course, is there any guarantee that these tight restrictions could be lifted after May 15th?
I've been really honest with everyone, and I'm going to stay honest. I don't know what happens on May 16th. I do know that every day we get closer and closer to a place and a space where we're able to start relaxing some of the restrictions.
But we're not there yet. And to change course now, we are told, is unthinkable.